What's going on, folks? Welcome back to the channel. I trust that you're all doing great. In today's video, we're delving deep into a captivating and vital topic, pulse oximeters. Whether you're a healthcare professional, a caregiver, or simply someone intrigued by the complexities of our bodies, grasping the significance of pulse oximeters is crucial. These small gadgets are essential for keeping an eye on our well-being, particularly in terms of blood oxygen levels. We'll delve into the workings of these devices, exploring their vital role in everyday health monitoring. Plus, I will provide you with tips on how to use them effectively and what to keep in mind if you are thinking about buying one. Ready to explore the mysteries of pulse oximetry? Let's delve in. As you're tuning in right now, you might be pondering, what exactly is a pulse oximeter? Essentially, it's a tool designed for swiftly and effortlessly tracking a patient's oxygen levels. This reveals its capability to assess oxygen levels in arterial blood non-invasively, eliminating the need for any invasive methods. It's usually a small, portable device that attaches to the finger and gives a quick reading. The device not only monitors oxygen saturation, but also provides a heart rate measurement. Arterial blood carrying oxygen flows from the heart to various parts of the body. It then diffuses through the surrounding tissues and cells, providing them with much-needed oxygen. If the blood is lacking oxygen, it may lead to inadequate oxygenation of your body tissues, posing a potential risk to your health. This can signal grave pulmonary issues, making it crucial to utilize a pulse oximeter. Respiratory therapists, along with other healthcare professionals, utilize these portable devices to continually monitor their patients' oxygenation levels and heart rates. These critical sign readings help enhance our comprehension of the patient's overall cardiopulmonary status. In certain situations, it is advisable for patients with cardiopulmonary issues to have their own pulse oximeter at home. So if that's you and you're in the market for a pulse oximeter, I have included a couple of links below to some of our top picks. How can we understand the functioning of a pulse oximeter? Pulse oximeters work based on a straightforward yet ingenious principle. The pulse oximeter essentially shines a light through your finger. By doing that, it can assess the level of oxygen in your blood. Blood has the ability to absorb light, and there is a clear disparity in the wavelengths that can pass through oxygenated and deoxygenated blood. The pulse oximeter's finger clip includes a transmitting light source that emits a broad spectrum of light. On the flip side, there's a receiver that gauges the amount of light that passes through the finger. The diode at the receiving end can detect the wavelength of light. The internal circuits and processing components of the pulse oximeter perform calculations to compensate for ambient light, such as room light or sunlight. They also take into account the size of the finger and the absorption capabilities of the surrounding tissues. The device is equipped with a stored reference curve in its memory. This curve is utilized to calibrate incoming readings and standardize them. This enhances the accuracy of the results offered. What does a pulse oximeter measure? As previously stated, a pulse oximeter measures the oxygen saturation in the blood and also provides a heart rate measurement. When discussing the measurement of oxygen saturation in the blood, I am referring to arterial blood. It assesses the quantity of oxygen transported by hemoglobin, and this value is referred to as SPO. The main purpose of a pulse oximeter is to determine the oxygen saturation. By performing this action, the heart rate is automatically calculated along with the oxygen percentage. Heart rate and oxygen saturation complement each other, providing valuable information for healthcare professionals to decide on the appropriate treatment for their patients. If you already possess a pulse oximeter, you might be curious about its proper usage. The most remarkable aspect of pulse oximetry is its non-invasive nature. In the past, doctors used to draw blood from patients and conduct multiple tests to determine the level of oxygen saturation. Now, we can obtain that reading in a matter of seconds by utilizing a pulse oximeter. All you need to do is clip the device either on the middle finger, ring finger, or even on an earlobe. Some models are designed as surface probes that can be attached to the patient's forehead or chest. Once the device is connected and powered on, it will quickly generate readings for you. To achieve dependable and precise readings, aim to minimize the patient's movements as much as possible. Also, when using a fingertip pulse oximeter, ensure that neither you nor your patient have any nail polish on. This may disrupt the precision of the measurements. Which finger is the most suitable for a pulse oximeter? Another common question I often encounter is, which finger is the most suitable for a pulse oximeter? If you are unaware, accuracy is typically the primary concern when it comes to measuring oxygen levels with a pulse oximeter. Some studies suggest that the middle finger of the right hand is most accurate. Surprisingly, the thumb of the right hand comes in second. This discovery has left doctors and medical practitioners surprised. The study also revealed that approximately 80% of healthcare workers prefer to attach the pulse oximeter to the patient's index finger. However, the differences were minimal, and any finger should provide an accurate reading as long as the device is secure. If you have to make a choice, the middle finger of the right hand is always a good option. If you've journeyed this far, you might be pondering, can a pulse oximeter be bought on Amazon? The answer is a definite yes. Each of the pulse oximeters we suggest is available on Amazon at a reasonable price. Make sure to consult with both your doctor and the manufacturer to confirm that the device is suitable for your needs, particularly if you are a healthcare professional. If you'd like to view our recommendations, feel free to check out the links below in the description. What are the risks of pulse oximetry? Now, let's delve into the potential risks associated with utilizing a pulse oximeter. Thankfully, there aren't any significant risks or dangers associated with using a pulse oximeter. The main priority is to make sure that the device offers a precise reading. This holds particularly true for doctors, respiratory therapists, and medical professionals. Inaccurate results from the pulse oximeter can impact the quality of patient treatment and care, necessitating to be our tags. While technically there aren't any risks in using the device itself, inaccurate results can have serious consequences if the readings fall outside the normal ranges. What are the normal ranges for a pulse oximeter? Now we must delve into the typical heart rate and oxygen saturation levels. The heart rate typically falls within the range of 60 to 100 beats per minute. The usual oxygen saturation range is between 95% and 100%. Please keep in mind that these values represent the average adult. The normal range may vary depending on age. While the typical range for oxygen saturation falls between 95% and 100%, levels dipping below 90% are deemed dangerously low, signifying a condition known as hypoxemia. This indicates that there is an abnormally low level of oxygen in the blood. Hypoxemia is managed with supplemental oxygen. If you frequently monitor your oxygen levels at home using a pulse oximeter and find that your readings consistently deviate from the expected range, it is advisable to consult your healthcare provider or seek professional medical guidance. And now the final step in using a pulse oximeter. Simply take your index finger and tap that like button. Just joking, that isn't a step, but your support is greatly appreciated and helps the channel grow. Alright folks, that, my friends, is essentially all you need to grasp about a pulse oximeter. Just one final reminder, I have included links to our preferred pulse oximeters for home use in the description below. I trust that this video was not only beneficial, but also enlightening for you. If you found value in our discussion today, I would greatly appreciate it if you could give that thumbs up button a click. Your support is greatly appreciated. Feel free to share your thoughts by leaving a comment below. Perhaps you have specific topics you're interested in or questions we could cover in a future video. I truly enjoy receiving your feedback, as it plays a key role in shaping the content we produce. And remember to subscribe to the channel and hit the notification bell. We have some incredible videos lined up that you surely wouldn't want to miss. Delve into the world of health tech, explore wellness tips, and discover much more. There's content tailored to suit everyone's interests on its way. That concludes this update. Thank you very much for sharing your time with me today. I sincerely value all of you. Thank you. I am eagerly anticipating our rendezvous in the upcoming video, where we will venture into even more captivating topics together. Until then, take care of yourselves, stay curious, and as always, breathe easy, my friend.